Welcome back, my dear students. Today we are going to learn about glomerulonephritis, an inflammation of the kidneys tiny filters, the glomeruli. When they are damaged, protein and blood leak into blood and the kidneys can't clean properly. This often follows on immune reactions like post-streptococcal infection, IgA nephropathy, lupus or vasculitis, and maybe acute or rapidly progressive or chronic. Key signs include dark urine, swelling of face and ankles, frothy, frothy urine, high blood pressure, and less urine. If untreated, glomerulonephritis may lead to chronic kidney disease. But the good news is, with early diagnosis, medicines, and lifestyle care, kidneys damage can be controlled. In this class, we will see what glomerulonephritis is, why it happens, and how it can be managed. Glomerulonephritis or glomerular nephritis. Glomerular nephritis, also called as glomerulonephritis, is an inflammatory disease of the glomeruli, the tiny filtering units inside our kidneys. When the glomeruli are damaged, they fail to filter blood properly. This allows protein and red blood cells to leak into the urine, leading to serious health issues if it is untreated. So glomerulonephritis is basically the inflammation of the glomeruli. When it primarily it starts in the glomeruli, but in secondarily glomeruli are affected by systemic disease. Acute symptoms develop suddenly and resolve without treatment, but if chronic, if acute disease not treated, when disease process develops slowly, irreversible failure of kidneys occur in case of chronic symptoms. Risk factors. Who is at risk? Certain conditions increase the chance of developing glomerular nephritis like infections, post-streptococcal throat or skin infections, viral infections like hepatitis B, hepatitis C, HIV, etc., autoimmune disorders like systemic lupus erythematosus, SLE, good pasture syndrome, vasculitis, that is inflammation of blood vessels, other conditions, diabetes mellitus causing secondary glomerulopathy, hypertension, high blood pressure, damaged kidney vessels, family history of kidney disease, long-term exposure to toxins or certain medications. Pathophysiology. What happens inside the kidneys? The damage usually occurs due to immune mechanisms such as immune complex deposition, which is the most common. Antigen antibody complexes get stuck in the glomeruli, it activates complement system and trigger inflammation, and obviously the damage occurs in the capillary walls. Direct autoantibody attack. Autoantibodies target the glomerular basement membrane, say for example in good pasture syndrome. Consequences: increased permeability, it causes leakage of proteins or proteinuria and RBCs or hematuria. Reduced filtration surface, in this case glomerular filtration rate falls or down, fluid retention occurs, and edema and hypertension is also is the symptom. Progressive scarring, it may lead to chronic kidney disease or CKD. So glomerulonephritis pathophysiology: deposition of immune complexes or antibodies triggers inflammation, and inflammation injures cells and degrades the GBM or glomerular basement membrane. Immune or post-immune mediated etiologies: primary or secondary, acute or chronic. Then RBC leak into urine, and some proteinuria can also occur. Management: how do we treat it? General management: rest and supportive care, especially in acute cases. Dietary changes like low salt control swelling and high blood pressure. Low protein reduces kidneys workload. Fluid restriction if there is severe edema or reduced urine output. Medications: antihypertensives, ACE inhibitors, ARBs, diuretics. It control BP and protein loss. Corticosteroids or immunosuppressants used in autoimmune or rapidly progressive cases. Antibiotics when infection is the cause, say for example post-streptococcal infection. Advanced or severe cases, dialysis. If kidney function drops severely, kidney transplantation. for end-stage renal disease. This is the normal situation, healthy glomerulus, and this is the glomerular nephritis where inflammation of the glomeruli occurs and it causes the damage to the glomeruli. It is followed by hematuria and proteinuria. In short, glomeruli is not just a kidney problem, it's an auto-inflammatory disorder that can progress to chronic kidney failure if untreated. But with early diagnosis, proper management and lifestyle modifications, patients can lead a healthy life. In today's class, we understood that glomerulonephritis is an inflammation of the kidney's tiny filter that can cause protein and blood to leak into urine, leading to swelling, high blood pressure, and kidney damage. It may occur suddenly, progressive rapidly, or develop slowly over years, often triggered by infections, immune reactions, or systemic diseases. But the good news is, we know with early detection, proper treatment, healthy habits, and regular follow up, kidney function can be preserved and complications can be prevented. Remember, watch for warming signs, protect your kidneys, and take timely medical care. Stay aware, stay strong, and keep learning. See you in the next class. Thank you.